The immune system naturally weakens as we age, and many Gen Xers are now at a higher risk of developing shingles, especially since that risk rises sharply after the age of 50. But staying informed and taking preventative steps can help reduce your chances of getting it. And Vice President and the Director of Scientific Affairs and Public Health at GSK Vaccines, Dr. Leonard Friedland, and Dr. Evelis Rivas, pharmacist at Albertsons, are joining us now to share more on the subject. Good morning to you both. How are you doing?
Good morning.
Great.
Well, we're thrilled to have you here. Obviously, valuable and vital information for our viewers out there. So why are people who are 50 years and older at greater risk for shingles?
Yeah, thank you. This is Dr. Leonard Friedland from GSK. And just as you mentioned, no matter how healthy we feel, the immune systems weaken as we get older. And starting at age 50, that's when the risk of developing shingles sharply increases. Shingles, sometimes called herpes zoster, it's a painful blistering rash, and it's caused by the same virus that causes chickenpox. And once you've had chickenpox, that virus remains dormant inside the body, and it can reactivate years later as shingles. 99% of all adults over the age of 50 in the United States have the virus that causes shingles inside their bodies. 1 in 3 people will develop shingles during their lifetime. So age is one of the most important risk factors for shingles, and age 50 is when that risk increases.
So for those who haven't experienced it, what is shingles like, and how can that affect everyday life?
So shingles is more than just a rash. It includes symptoms like fever, headache, chills, and upset stomach. It can also be associated with pain that can last for weeks. And that pain can affect your day-to-day life, like hobbies, hanging out with family and friends, and going to work. It can happen at any time. Shingles has no regard for what's on your social calendar.
So are there any other risk factors for shingles, aside from the age for adults 50 years and older?
Yeah, absolutely. I mean, we've talked about age being one of the most important risk factors for shingles because the disease occurs mostly in people 50 years of age and older, but stress can also increase your risk. Additionally, certain health conditions like diabetes, chronic kidney disease, and heart diseases, these have all been associated with an increased risk of shingles. So if you're 50 years of age and older, particularly if you have one of those underlying health conditions, ask your pharmacist about your risk for shingles and about prevention.
So why is now a good time for adults 50 years and older to ask their local Albertsons pharmacist about shingles?
Adults 50 years of age and older still feel healthy and are still feeling young, but as Dr. Friedland mentioned, that immune system does begin to weaken once that 50 years of age hits. Risk of developing shingles does increase with age, and shingles is more common than we all know. 1 million people develop shingles every year in the United States. And as a reminder for those born before 1976, with that increased risk of getting shingles, that makes it the perfect time for you to ask your local Albertsons pharmacist about your risk for shingles and about prevention.
I'm sure there's plenty of viewers out there watching right now who may never heard of shingles, may not understand about it. But where should they go to learn more about shingles and the preventative measures and what to experience?
Yeah, certainly for those who are 50 years of age and older, speak to your doctor, your healthcare provider, your pharmacist, your local pharmacist, including at Albertsons, and ask them about your risk for certain vaccine-preventable diseases, including shingles, and that's how you can learn more information. In addition, there's a website, easyvax.com, E-A-S-Y-V-A-X, easyvax.com, where you can go, you can locate a pharmacy near you and make an appointment to then go in, speak to the pharmacist to learn more about vaccine-preventable diseases, including shingles, and about prevention.
Dr. Friedland, Dr. Rivas, thank you so much for your time this morning. We really appreciate it.
Thank you.
Thank you.
Pleasure. Now, for more information on shingles prevention and treatment, just head to easyvax.com.